Coming up, we'll be on location at Virginia Endodontics in Fairfax, Virginia, discussing the benefits of endodontics and how they can help restore your dental health with minimal discomfort and downtime with one of this region's top endodontists, Dr. Joshua Fein. Dr. Fein received his DDS degree from the University of North Carolina School of Dentistry. He completed his master's in oral biology and received his certificate in endodontics from the University of Maryland Dental School. Dr. Fein is a member of the prestigious American Association of Endodontists and is widely recognized as one of this region's leading doctors. Welcome, Dr. Fein. It's a pleasure having you on our program.
Thank you. The honor's all mine.
It's your first time, in fact, on the Top Doctors Medical Interviews. We have a lot to talk about. We've got some patients that are going to be joining us a bit later. But I wanted to begin, if I may, Doctor, by asking you if you can please tell us what endodontics is.
Sure. Well, endodontics is the field of dentistry having to do with the pulp. And the pulp is the nerves and blood vessels, pretty much everything that makes up the inside of the tooth. So you have your enamel and dentin, or the harder tissues, and then the soft tissue in the middle of the tooth is the pulp. And that's the field that we're always digging around in.
And how would you say it's different than, say, a general dentist?
Well, general dentists do some endodontics in office, but when you have the more complex cases, whether it's technical or due to various patient issues, often they'll refer to a specialist because we have advanced training in this area.
The additional specialized training really is what separates an endodontist from a general dentist.
Precisely. It's the experience as well as the equipment. We have specialized training using a lot of different advanced equipment and techniques that, frankly, there's not time for in dental school.
Yes. And that brings me to my next question and the topic of today's interview, and that is, can you please tell us about some of the latest advances that have taken place in endodontics and how they can help so many of us?
Sure, absolutely. Well, there are a few things that we use with every patient. The first and perhaps most important is the surgical operating microscope. We chose to purchase ours from Zeiss, which I think is the world's top manufacturer of microscopes. You probably see it on various TV shows like Grey's Anatomy all the time. And these microscopes allow us visualization that we didn't have 20, 30 years ago. So coming with all the advances are increased success rates. So our success rates now in endodontics are extremely good. And a lot of that is to do with the newer technology. The other thing I really want to stress that is revolutionary is the CBCT, which is the 3D X-ray machine. This is allowing us to see things that we could never see before, complex cases that we can't figure out why they're failing. Now we take a 3D X-ray and we know right away, oh, there's this crazy little extra canal that no one had been able to find before, and helps us with anatomy and all kinds of other things that we previously were not able to see.
Basically, the advances in technology have taken everything to another level that is all to the benefit of the patients.
Precisely, precisely. I think that with all the advances, like I said, come increased success rates. And now endodontics is really a painless procedure that, done with all this new equipment, can be done quickly and very effectively.
What types of problems does endodontics address, doctor? Who would be a good candidate, in other words, that's watching?
Well, I'll say almost everyone is a good candidate for endodontics. There are, of course, always extenuating circumstances where a patient can't undergo endodontic treatment. But we treat people of all ages, as young as we'll see patients 4 and 5, and we'll see patients into 100 plus. And we are very comfortable here with patients of all age. But people who need endodontics are usually those who are either having pain. It's patients who have infection that may be growing underneath the surface that they're not aware of. Or also sometimes there are situations where the dentist might need endodontics in order to restore the tooth. We see various different patients for various different reasons, but our business is saving teeth. So we see people who want to keep their teeth, and nowadays people are keeping their teeth longer and longer, and we're here with you for that.
Now, what type of results can we expect from the treatments that you now offer?
Sure. Well, the studies show success rates run in the 90s, so very good success rates, but I'll tell you, the studies also show with endodontists, those numbers go up. So like I said, general dentists do fantastic work. and we work with some fantastic general dentists. But there are sometimes cases that just need a little bit of specialized training. So with that specialized training like I said, comes the greater technology and the years of practice that allow us to increase those success rates. One of the important things about being an endodontist is working closely as a team with the other specialists and your general dentist out there. So there are some times where general dentists will start a case and we'll help them kind of get over the hurdle of finishing it, or certainly, they'll send a case to us and then we send them back to the general dentist who's going to do the extremely important restorative work that the studies show are actually as important to the success rate as the actual endodontic work itself.
Yes, no, very well said. You're absolutely right. A general dentist is where it all starts.
Exactly.
That's who we see.
It all starts and it all ends there.
Yes, we always see the general dentist throughout our lives. At least we should be seeing the general dentist.
We should be.
That's right. But when it comes to certain problems, an endodontist like yourself is the one who would handle it, or in other cases an oral surgeon or an orthodontist. These are the examples we're talking about.
And often emergency situations arise where an endodontist is necessary. So we are always happy to see people, one of the things we pride ourselves on here is evening hours, weekend hours, because we want everyone to have access to the care they need. Yes. So we do our best to accommodate patients whenever they might need our services.
We're now going to meet some patients of Dr. Fein and Virginia Endodontics. Welcome, John. It's a pleasure having you on our program.
Good afternoon.
We appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. I just wanted to begin, if I may, John, by asking you if you can please tell us what brought you to Virginia Endodontics.
It was an interesting story. I went to my general dentist who evaluated me and believed that I needed a crown, but she wasn't certain that I needed a root canal. So she referred me to one of the practitioners that she normally refers to, and I went home and called that practice, got put on hold several times, couldn't get through to actually talk to a person. So I decided to take matters into my own hands, and I looked up nearby endodontics and found Dr. Fein and made the call to this office, and it was a whole different experience.
Totally different from the other one that you were trying to contact.
Totally different. Pleasant, responsive, no being put on hold. Immediately got an appointment, and then I came out to see Dr. Fein for the first time.
So then what took place? What was the root of that problem, if I may use that phrase?
He evaluated whether I needed a root canal based on my dentist's suspicion and determined that I did. And while we were right there on the appointment, he decided to go ahead and perform the root canal.
And how long did it take?
I would say no more than 45 minutes. I've had root canals done before, and this one was, I can't say a good experience for a root canal, nobody would say that, but it was pretty painless and efficient, and Dr. Fein was very nice, and it worked out very well.
It's always nice to hear the word painless when it comes to coming to the endodontist.
I had another experience with Dr. Fein, probably about 5 or 6 months later. My dentist once again determined that I might need a root canal. Now, when I had visited Dr. Fein the first time, I suggested that he establish a referral relationship with my dentist because he hadn't had one up to that point. And I thought that if I ever needed a root canal again, I'd like to be referred here. And that's what happened. The second time I was referred here for a second root canal, went very well. And I believe that Dr. Fein and my dentist have established an ongoing relationship.
That's wonderful. That really speaks volumes about how you feel about Dr. Fein and your experience here with Virginia Endodontics, because for you to even set up the referral network with your general dentist, that really is something else.
Yeah, I think it worked out well for everybody.
And before I let you go, John, what would you tell the folks out there watching right now about your experience with not only Dr. Fein, but the staff here as well at Virginia Endodontics?
Well, the staff here is wonderful. I've dealt with them obviously for appointments and so forth, and for billing and things like that. Had no problem whatsoever. They're very, very friendly and had no problems whatsoever. And Dr. Fein is as well. He's got a good sense of humor, and even while you're having your root canal, there's some dialogue that keeps your mind off of it.
Well, that's wonderful to hear. And on that note, I'd like to thank you again, John, for coming down, sharing some of your experiences with us, and being a guest on our program.
I appreciate it. Thank you.
Welcome, Travis. It's wonderful having you on as well.
Thank you very much, Ed.
Now, I wanted to ask you what I just asked John a few moments ago, and that is, what brought you, Travis, to Dr. Fein? Were you experiencing some pain, or what problem were you experiencing?
I was told that I had to have a cavity filled by a dentist, my longtime dentist, and she did that filling. Unfortunately, she moved, and I had to find another dentist. Okay. And the follow-up dentist did a little bit more work and told me that root canal might be necessary. That person moved, and so yet another dentist performed a root canal. And after that, the tooth was fine for about 3 months, and then I started to feel gradually a little bit of feeling, pain, but it was definitely a little uncomfortable. And so I talked with some friends who had outside experiences with endodontists, and they said you should look up one. And so I did. I found Dr. Fein. He was local to my business and where I live, and I was able to quickly make an appointment. And then that brought me into Dr. Fein's office.
So then you came here, you met with Dr. Fein, and what happened?
I met with Dr. Fein. He, the first time that he met, he did a series of x-rays, a 3D x-ray, a normal x-ray. He did a series of small tests, and he poked around a little bit, and he gave me a very clear understanding of what probably was the cause. He showed me on the x-ray the filling that the original dentist, the original root canal, had done. He showed me where it might be done a little better, and so he showed me, what he thought he would do when he would do that. And then we made a second appointment. Came in a few weeks later, and we did the second root canal, and that turned out much better.
All right. And did you experience much pain or anything like that
during the root canal process? Obviously there's going to be a little bit of pain, but no great discomfort. He even took my feedback on my prior experiences of pain management, and he took that into account, and so I appreciated that. He also told me when he was going to start doing things, when I should expect to feel some sensations, and when it should all be over. And a very smooth process.
Lastly, before we let you go, Travis, for the folks out there watching, any final thoughts you'd like to share with them?
I would encourage you to contact Dr. Fein. His staff is great, and you'll probably find an appointment pretty quickly. And I believe that Dr. Fein will do a good job for you.
Well, on that note, we thank you as well for joining us and being a guest in our program.
Yeah, no problem.
Welcome, Steve. It's nice having you on with us.
Thank you. Thank you for having me.
Now, I wanted to begin by asking you, Steve, if you can please tell us what problem or problems were you experiencing that brought you to Dr. Fein?
I had terrible pain in my rear lower mouth, and I had that pain for several weeks, and I called Dr. Fein's office, and I was able to come in on the same day. I was extremely happy that I called. It was in the early morning, and the person who answered the phone said to me, "No, we can get you in today. Dr. Fein can stay late." And I was very happy because I had called some other places, and no one was willing to, take me that day. I waited to the last minute till I was excruciating, and I couldn't take the pain anymore.
So then you came in, and what happened, Steve?
Unfortunately, I've had root canals before, so I kind of knew the drill. And immediately I was impressed by how nice the office was, how pleasant everyone was at the reception. They took me immediately, as I mentioned. I had a small situation with my insurance that hadn't been approved yet and whatnot, so we just went ahead and did the procedure. We didn't worry about that, and it went very smoothly, and I was relieved of pain that same day.
What was the process or the treatment itself like for you when you were in the chair?
Well, we did the initial numbing, and as I mentioned, I had a root canal about 2 years ago, so I'm very familiar with the process, and it was very quick. I like his room. It's very comfortable. There's a lot of light here in the office, especially looking out, and there's TV sets. You have the cable television and all the stations, so I was watching television at the same time. It was pain-free. It lasted less than an hour, and like I said, I was good to go. That whole weekend I was able to actually sleep because I was waking up in the middle of the night with my mouth was throbbing.
Oh
prior
my!
To that. Oh, it was terrible.
Yes, and that then affects one's life in all areas. When you can't get sleep and you're in so much pain, so you came here, you left pain-free, like you mentioned, and it really is a spa-like environment. It's so tranquil, and it's really nice.
Correct. It was a great experience.
And before we let you go, Steve, for the folks out there watching, what would you like to tell them about your experience with the staff here as well?
Oh, the staff was exceptional. You know, they, as I mentioned before, they took me that day. We worried about payment afterwards, and everything was great.
Well, on that note, I'd like to thank you, Steve, for coming down, sharing some of your experiences with us, and being a guest on our program. It was our pleasure.
Oh, you're welcome.
We're now back with Dr. Fein. I must say the patients are very happy with the results. Great work, Dr. Fein. And in Steve's case, to see him describe his immense pain that he was going through and be able to see you the same day when he, you know, they were having problems getting through to other endodontists as far as delays on the phone, an appointment down the road, but you were able to make it happen the same day and took great care of him and the others.
Well, thank you. And it's really important to us to be here for our patients. So often we will have patients who are have major phobias, who have been unable previously to even get into the dental chair. So maybe our first visit is just about, you know, getting them comfortable and getting them into the chair and letting us take a look, and then they'll come back when they're comfortable, and we'll get service done. So I really pride myself here on both myself and my staff of working with people who are very phobic, as well as people who've had bad previous experiences.
Yes. No, you really accommodate them and customize very effective treatments for them as well, not to mention take great care of them, as we just heard. Now, is there any downtime that patients could be looking at from any of these treatments that you've talked about?
Typically, no. We'll very often have people go back to work or school on the same day as having treatment. Now, sometimes when we do surgical therapy, we do some advanced surgical techniques here. Those have a little bit more recovery. Usually within a day or two, people are back to normal life. And even after that, it doesn't really prevent, you know, going about your day, but might be a little more discomfort than just from the root canal. But generally, for most people, a little bit of soreness that goes on for a day or two is all they'll complain about.
And how long do the results last? And I put in the disclaimer that I'm sure that depends on each particular patient and what was done and what problem was treated, but in general, what are we looking at?
Sure. Well, root canals should be, like I said, extremely successful. And if a tooth is restored well afterwards, and again, with so many fantastic dentists in this area, I would be very confident that it would be. With a good root canal and a good filling and crown, there's no reason that tooth should last any less time than any other tooth. So a well-restored, well-treated tooth, as long as you're keeping it clean like any other tooth, should last you your whole life. Now, of course, situations arise where root canals do fail, but like I said, we pride ourselves on a very high success rate of comfort and of life for the tooth.
Well, that's certainly good to know, Dr. Fein. Now, we're literally out of time. I wanted to ask you, before I let you go, you and your practice, Virginia Endodontics here in Fairfax, Virginia, have established a reputation for excellence, not only in endodontics and treating so many patients, but patient care as well. And I just wanted to ask you what you feel helps separate you apart from the others.
Sure. Well, that's a great question. Thank you for asking. I think we bring a wealth of experience to patient care that I think some offices lack. I have experience, actually, I used to be a teacher before I went to dental school, so I'm very comfortable working with children, so that's one area that we do see a fair number of patients. But most importantly, from the moment a patient calls on the phone to any follow-up appointments after treatment, we want patients to always feel that we have gone out of our way to give them the best possible care possible. And that doesn't just include the root canal, that includes, like I said, your communications on the phone, anything with radiographs, and that includes every staff member who works here as well. So most importantly, we see patients as family, and we want them to be treated as such. So from, like I said, every moment that a patient deals with Virginia Endodontics should be a good moment.
Yes, indeed, and the patients that we had on attested to those exact points, not to mention others that we've spoken with. And I can just let you know, Doctor, that we really appreciate you coming on, enlightening us, educating us, being a guest on our program. It was our pleasure, and we'd love to have you back on in the future.
I look forward to it. Thanks so much.